Hi, good morning, Chris. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 22nd of August 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Chris Maven.
And what is your candidate number, please?
My candidate number is 240821897.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are your professional goals?
My professional goals are as follows. Earn my MN, join the Emergency Nurses Association, and become an emergency room nurse practitioner. I hope to mentor nurses and share what I have learned. I am excited about the opportunity to fulfill my goals. Last, I would like to advance into a management role as well, where I can oversee and train nurses. I feel drawn toward helping others grow and learn.
How do you like working with a team?
I thrive while working as a part of a team because of my ability to adapt. I find that working on a team allows for the best outcomes for patients. Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions to issues. Also, working on a team motivates me because I enjoy celebrating the successes of others. Last, I feel confident in my ability to work alone as well.
What is your idea of effective patient and family education?
We have to understand their learning style and adapt accordingly. For example, some patients prefer reading medical instructions versus watching a DVD. Also, need to figure out what each patient needs. Some want detailed information. Others just want the necessary information. Including the family in the treatment process is crucial because they may end up serving as primary caretakers for the patient going forward. Show them how vital they are to the process and key them in on how they can help.
Describe a situation where you were under a lot of pressure.
I experienced pressure every day as an ICU nurse. On one occasion, I had to cover more patients than usual because of a coworker calling out sick. I decided to create a list and prioritize care. By organizing and paying attention to detail, I was able to manage my increased workload successfully. After work, I often practice yoga so that I don't take any of the stress with me.
How do you address questions from a patient's family and friends?
I lead with empathy. I know that I need to give them the best information that I can. However, I try to make sure that I'm answering them in kind ways, and I imagine myself in their shoes. Now, I know that I can't answer all of their questions, so I try to set boundaries and make sure I'm not enabling either.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking roleplay. Don't worry if I stop you when the time is up.
Hi Mihiraa, good morning. I am Chris Maven, your attending nurse here today. How are you?
Good morning, Chris. I am doing well.
Mihiraa, I am here to provide you with information about chemotherapy.
All right, nurse.
Well Mihiraa, I would like to know your feelings about starting chemotherapy.
About my feelings. Nurse, I am really worried about chemotherapy, mainly because this is the first time.
I know, you will be worried about having chemotherapy, especially for the first session. This being your first chemotherapy session, I wish to hear from you about your knowledge of chemotherapy.
I did not explore much about chemotherapy. What I know is all that my doctor told me during the consultation. The doctor said the aim of chemotherapy is to reduce the risk of cancer returning after my bowel operation. Besides, I don't remember much else.
All right. What you remember about the aim of having chemotherapy sessions is correct. And do you remember the frequency of the chemotherapy session?
No, nurse.
It's okay. And what about the duration of the session?
Well, I can't recall what the doctor said.
That's fine. I will provide you with the course of treatment. The chemotherapy session will be a 3-week cycle procedure. Totally, the session will take 24-week treatment periods for completion. Chemotherapy will be administered at the day clinic. By the way, Mihiraa, I will give you the patient information leaflets, which contain information about what you can bring for the procedure, details of the procedure, pre-treatment medication details, and so on.
That will be of great help, nurse. I will read the information leaflet that you will give me. But, if you don't mind, can you please brief me on what exactly will happen during the procedure?
It's all right. No worries. I will explain the treatment procedures to you.
That is so kind of you, nurse.
My pleasure, Mihiraa. The treatment procedure begins with a blood test. Before each round of chemotherapy, you will have a blood test.
Oh, I see.
Afterwards, chemotherapy will be performed. The drug is infused into the vein, that is, intravenous delivery of chemotherapy drugs will be carried out for you.
Okay. I got it.
After chemotherapy, your doctor and treatment team will constantly monitor the effectiveness of your treatments. Moreover, you will be provided food and fluid after the chemotherapy. The duration of the procedure may vary from 3 to 8 hours, depending on the situation.
Okay, I understand that.
Mihiraa, I will make some recommendations to pass time during the procedure. Some of the methods you can adopt include reading books, and can use electronic devices such as music players or video players in headphone mode to make you comfortable.
That sounds good, nurse. It's a good idea to bring something to pass the time. I hadn't thought about that.
Yes, Mihiraa. Now, I would like to bring your attention to some of the common side effects of chemotherapy. After the procedure, you may experience nausea and fatigue. There is a lot of chance of losing your appetite and taste as well. Try not to bother about it too much. These will fade away sooner.
Okay, nurse. I know about the side effects. But I was concerned that they might be quite serious.
I appreciate your thoughtfulness. More importantly, reactions to chemotherapy are different for each individual. Mihiraa, there are several reasons for the reactions. It depends on factors like the medication, duration of treatment, level of your fitness, and so on.
Oh, okay.
Mihiraa, don't panic hearing the same. I can reassure you that we will be here to help you. Apart from that, other assistance available for your condition includes medication for symptom relief, and helpline numbers to clarify concerns, or to get advice.
All right.
Mihiraa, I would also like to remind you that you need to make transport arrangements after the sessions. It is because, after the procedure, you are not allowed to drive. May I know, is there anyone to accompany you back home?
Yes, nurse. My sister will be picking me up after the procedure.
That's perfect. Do I have to address any more concerns?
No, nurse. I am now feeling more informed and prepared for my first session of chemotherapy.
That's great. I wish you all the very best, Mihiraa.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.